do it.
Who is on the telephone to talk with us this morning. Good morning. You're on KSJE. Thank you for calling in this morning.
Good morning, Scott and Megan. This is Jeff Bourgeois. How are you all today?
We are good. Jeff Bourgeois, thank you for calling in, CEO of San Juan Regional Medical Center, of course. And you and your employees and staff have been our thoughts since we keep hearing about and seeing these numbers that are increasing across our county. And so can you give us a start, Jeff, by telling us what your numbers are looking like on this Monday morning, please?
You bet. It's been relatively stable over the end of last week, over the weekend, but that said, very busy. The total census right now, as of 6:30 this morning, was 149 total patients. We had 64 COVID positive patients and another 9 on our respiratory floor that had either another respiratory diagnosis or were pending test results, for a total of 73 respiratory patients. So very, very busy in that regard. Total of 13 intubated patients, 11 of those are COVID patients. So continued high level of COVID and respiratory illness impacting our census.
Right, and that seems high to me, Jeff, from the numbers you've been sharing on these last few times you've been with us. And I should be writing these down to see what they were compared to like last Monday. But are they higher than they were?
Scott, I would say yes. Let me go back to another report. A lot changes in a week, but we really had an increase over the past week, and but reached that level before the end of the week. And so that's why I say it's kind of stable to where it was towards the end of last week and over the weekend.
Great. And Jeff, recently the governor released a statement stating that individual hospitals would now be given permission to triage if necessary. Do you have any comments on that?
Well, that, Megan, would be part of a crisis standards of care plan that is in, that plan has been written. She has asked the medical advisory team that advises her and Dr. Scrace to determine if and when it's time to declare crisis standards of care. And at that time would be when triaging and rationing of care could potentially happen, depending on the circumstance at any individual hospital. So there was an article in yesterday's Albuquerque Journal around this. And we expect that maybe sometime this week, maybe as early as today, the governor could declare crisis standards of care.
Right. So is San Juan Regional Medical Center close to doing that, or are we just kind of waiting on seeing if we cross over that crisis line?
It would be a statewide order, Megan, and then we have a triage board established of key clinicians within the hospital that just because the state declares it doesn't mean we're necessarily there. We've had assistance from the Albuquerque hospitals as well as St. Vincent's in Santa Fe in helping us decompress our inpatient census on an as-needed basis, really, and we're able to move patients there to help decompress our ICU and our other respiratory units, so we can plan for additional admissions. So we're not there yet, but that could happen depending on what's ahead of us in terms of a continued increase in census, particularly in COVID-19 patients.
Understood. And I guess, Jeff Bourgeois, with this on declaration, if and when it comes from the governor, would that give, I guess, your local folks there at the hospital some more options, or at least some more wiggle room in case you can't depend on these other hospitals to help you decompress those numbers? I guess that's my question. Just more options for you and your team?
Yes, it could. It certainly could. You know, the key thing that everyone wants to avoid is if there aren't enough ventilators to go around, how do you make the decision of who gets one and who doesn't? You know, and so, you know, she's quoted in the article from yesterday saying that the goal is to relieve the burden on our frontline healthcare providers to ensure they aren't asked to determine whose life is most valuable. if, say, only one ventilator is available for multiple patients. So our plan is on a statewide basis among our hospitals to avoid that type of situation. But that option does become available under a crisis standards of care declaration. But again, everyone is working hard to avoid that.
Understood, and I appreciate that, and it's a difficult situation to be placed in, I think, for you and your team. And I want to ask you just a bit about how this impacts other patients at the hospital. You've gone to great detail to explain to us how COVID or COVID suspected patients are being kept separate, obviously, from your other patients and things like that. And so for other types of care, people are still having heart attacks. We've talked about that. People are still getting into car accidents. And so, is the hospital then obviously able to then deal with these other patients for non-COVID situations while this other stuff is going on? Can you explain how that works and is working?
I'd be happy to. First of all, we always want to encourage people to seek care when they need it, particularly if you're having something that might be related to a life-threatening event like a heart attack or a stroke. Or just other serious illness. Do not delay in seeking care, whether that be contacting your physician or coming to the hospital. We've heard anecdotal stories nationally about how patients avoiding care end up in a worse case scenario than they would have had they sought care earlier after the onset of their symptoms. Scott, I would say it's fair to say that statewide hospitals, systems, and resources, whether they be supplies, manpower, et cetera, are being stretched and really called to develop and implement contingency type of care plans. For example, one thing we've done is we have a 16 bed unit on our 5th floor that is routinely our cardiology unit. So patients that aren't quite sick enough to be in the ICU but have a coronary diagnosis, we locate them on the 5th floor. Well, we moved those patients down to a lower floor so we could use those 16 beds for respiratory beds because we needed them. And so you start combining different types of patient populations and having to move staff around. And that is an example of something we've done that is very similar to what most of the hub hospitals in the state have had to do. And the hub hospital, again, is a hospital. We're one of 7 in the state that is, according to the state's disaster response plan, we are designated as a hospital to receive transfers in from certain hub facilities. And then, of course, the core hospitals in Albuquerque are the core hub hospitals, and we routinely send patients to them as well.
Very good. And one more question before we let you go, Jeff. There, at one time, I believe, on the show, we discussed, because of our concern for the staff and the frontline workers, there being some sort of protocol where a group of workers might get some leave and the other team comes in and then you swap. Is that kind of stuff happening, especially now as this second wave is just barraging us?
What we have, Megan, it's a good question, is it's not kind of a rotating team like that, but we of course want to get caregivers who've been on the front line for an extended period off and get some rest. We encourage PTO where they can, but we're also at the point where we need to encourage staff to hang in there with us. So we've implemented some extra shift incentives for additional compensation should we ask someone to come in and work an additional shift above and beyond their routine schedule. Additionally, we brought in a number of agency staff, particularly nursing and respiratory therapists, to assist our permanent staff with staffing needs throughout this surge.